Hello everyone, I'm Dr. ElSaygh. I'm going to be one of the doctors walking you through today's module. We're going to start with heart rhythm problems. To further understand heart rhythm problems, we need to understand how electrical activity normally flows through the heart. As you all know by now, the heart has four chambers, two atria and two ventricles. The rhythm usually starts in the atria in an area called the sinoatrial node. It then travels through the atrial tissue and reaches the atrioventricular node, which sits between the atria and the ventricles. And after that, it goes to the ventricular tissue. Normally, when we discuss the problems of the electrical system, it could be a problem of regularity and it could be a problem of speed. So sometimes there are electrical issues in the heart that can cause your heart rhythm to be irregular, too slow, or too fast. Some of the symptoms that you can recognize if you have problems with the electrical system of your heart is sensation of a skipped heartbeat, palpitations, feeling dizzy or lightheaded, sudden shortness of breath, periodic weakness, and sometimes even fainting or sudden losses of consciousness. There are various examples of issues with the electrical system of the heart, and over here in this slide, I listed some of the common disorders of electrical activity. One of these are called atrial fibrillation. In atrial fibrillation, the atrium, which is the upper chamber of the heart, fires irrespective of the ventricular rhythm. And what ends up happening is you could have a very elevated heart rate and your rhythm would be irregular. In atrial flutter, it's similar to atrial fibrillation as in it originates in the atria. However, usually with atrial flutter, the rhythm is still regular. Supraventricular tachycardia is a subset of electrical disorders of the heart in which supraventricular, which means above the ventricle at the level of the atria, there is an elevation in the heart rate. Another example of electrical disorders of the heart is sinus bradycardia, in which the rhythm is regular but it's too slow. Another example is heart block, which could be subclassified into different degrees of heart block, but that's normally when there's a issue with the conduction of the electrical activity from the atria to the ventricle, normally at the level of the AV node or the atrioventricular node. In addition, there are some electrical conduction abnormalities that affect the electrical system within the ventricles, and that could go from left and right bundle branch blocks, ventricular tachycardias, and even ventricular fibrillation, which could be the most deadly. To diagnose disorders of the electrical activity of the heart, your physician might order an EKG. An EKG is a non-invasive test to check for the rhythm of the heart. It usually involves the placement of some stickers in the chest and hooking you onto a machine that then gives us a read, and your physician is able to analyze that. The next step is a Holter monitor, and this is a monitor that you usually wear from days to weeks, and this monitor checks the rhythm of your heart at all times that you're wearing it, and it's usually reserved for patients in which the EKG was not really significant of a finding. There are also tilt table tests, which you are in a tilt table and it measures the electrical activity of the heart and it's able to elicit some of the arrhythmias. And lastly, electrophysiology studies, and these are more invasive studies, usually done under sedation in an operating theater, where the electrophysiology cardiologist is able to map the electrical activity of your heart in a more sensitive and specific manner. If your physician then classifies you as someone that has an irregularity with the electrical system of your heart, there are several ways in which this could be solved. The first and most commonly used is medications. There are many anti-arrhythmic medications, all with different side effect profiles that your physician will be able to discuss with you. These pills usually are either daily or twice a day, depending on the pill, and most patients have good success with the anti-arrhythmic medications. The Second is a pacemaker. A pacemaker is a device that's implanted to the chest and is able to guide the electrical system of your heart when your heart is unable to do so for itself. There's also implantable cardiac defibrillators, which have the ability of a pacemaker, but in addition, if your heart goes into a deadly rhythm, they're able to deliver a shock to your heart to be able to revert it to normal rhythm. And this subset of devices is usually a life-saving device. Lastly, there are some procedures such as atrial fibrillation ablations or atrial flutter ablations, which are similar to an electrophysiology study in which the electrophysiologist will map the electrical system of your heart. And from there, the electrophysiologist is able to ablate or burn down some of the areas that are responsible for generating this abnormal rhythm. Of all of those, these procedures are usually the longest and are reserved for patients that have failed other medications. Finally, we reached module 11, and in module 11 we're going to be discussing clinical trials. So, what are clinical trials? Clinical trials are research studies in which information or data is collected about its people with a specific medical condition to learn more about the condition, or to determine whether new treatment can actually help people suffering from a certain condition. Information gained from clinical trials therefore helps us understand more about disease and how best to treat it. There are different types of studies. The first is an observational study, and in an observational study, there is no introduction of a medication or device. Instead, it's like looking at a community of people with the same disease and observing them from a bird's eye perspective and seeing how they do. These studies are good because they're able to give us data about a population level of patients. The second is a therapeutic trial. In a therapeutic trial, there is an there is a start of a medication or a device or an intervention, and then we're able to study if this device, medication, or intervention helps patients from a certain disease. Next is an open label trial. In an open label trial, both the person running the trial and the patient is able to know which medication, device, or procedure they're receiving. And lastly, we have randomized trials. And usually, randomized trials are blinded, which means neither the person initiating the trial nor the patient know which medication, device, or procedure they're receiving. And the point of a randomized trial is to reduce bias and be able to generate results which are generalizable to a large subset of people. So, there are many pros of joining a study. The first, if you join a study or a clinical trial, you're able to contribute to the advances in science. In addition, it's been proven by multiple studies that patients enrolled in trials have close follow up. And because you have close follow up, usually catered by very well trained experts, you generally actually do better than patients not enrolled in studies. In addition, most trials cover the cost of the medication being tested. So if you're someone that has a hard time getting medication, joining a study is one way to guarantee that you receive a medication. However, there are some cons to joining a study. Some trial medications end up to have no benefit or potential harm, and oftentimes these side effects are not something that the people introducing the study are aware of until they test it on patients. And lastly, sometimes in trials in which there is no scientific benefit, some patients feel better on the medication, so they're used for compassionate use of the medication. So the cons of the joining a study are usually minimized by several ways, which we will discuss in the next slide. Although clinical trials are very important, it's also more important to maintain the safety of clinical trials. The first is by actually instituting an informed consent. In an informed consent, the person initiating the trial or one of their team members is able to discuss with you the specifics of the trial and is able to answer questions like the cost of the medication, the potential side effects of the medication, what you are supposed to expect, and how often are you going to be following up. The reason for the informed consent is because it is one of the main conditions into joining a trial, and it's the perfect opportunity for patients to actually ask questions and be able to make an informed decision about joining a clinical trial. And there's also a data safety monitoring board. A data safety monitoring board is an independent board that overlooks all of the data and is not blinded like the participants or the people initiating the trial. And what the data safety monitoring board does is overlook the data from a clinical trial. And if they realize that this clinical trial is unsafe or is potentially harmful more than beneficial to the patients participating in the trial, they're able to alert the members of this trial and are even able to stop the clinical trial. So there's always an independent party that overlooks clinical trials to make sure they are both safe for everyone as well as ethically correct. Thank you all for listening.